Are you suffering from nasal obstruction? Are you always living under the fog of sinus pressure, headache? You have tried sprays, multiple pills, tablets, but nothing seems to work. What if it is not just cold? What if it is a problem with your nasal architecture? Hi, this is Dr. Debayan Tarafdar. I am an ENT surgeon working in Kolkata. And let us today decode the mysteries of nasal surgery. To understand the nose better, think of it as a house. So it has a middle wall that is called the nasal septum, and there are multiple rooms in the side, which is called nasal sinuses. So in a perfect house, the wall should be straight, all the doors to the rooms should open properly, and the room should be well lit and aerated, and the door should open properly so that the garbage from the room can be taken out. But unfortunately, that is not the case with many of us. Problem number 1. If the middle wall is crooked, in medical term, we call it a deviated nasal septum or DNS. So what will happen if the middle wall is crooked? It will block the entire hallway. And that's why you feel that you are not able to take breath freely through your nose. That can give rise to nasal obstruction, recurrent congestion, even snoring. To fix this, we do a procedure which is called septoplasty. So in septoplasty, we as surgeons, we go inside your nose with an endoscope and we correct the deviation of the septum so that the wall can be straightened again and it will not block the hallway and you will breathe better through your nose. Remember, we are not removing your septum. Our main purpose is to correct the septal deviation and make it a straight septum so that it does not block your hallway or your nasal cavities. Problem number 2, the rooms or the sinuses. In chronic sinusitis, the doors of the sinuses are shut. That's why there is mucus retention inside the sinuses that can lead to an infection, terrible headaches, facial heaviness, and it can also lead to polyps, which are tiny little masses which can cover up the whole sinus, even the nasal cavities. To treat this, we do a procedure which is called FESS or FESS or Functional Endoscopic Sinus Surgery. As surgeons, we go in with an endoscope again, and with the help of specialized instruments like microdebrider, we open up the doors of the sinuses so that the sinus can drain better. We also clean up the dirt and the mucus which is there inside the sinuses, and sometimes we remove all the polyp which is developed inside the sinuses. In that way, we are restoring the normal sinus function so that it can drain out properly by opening it and removing its dirt. I get asked quite a lot of time, do we need to undergo both the surgeries together? Now think of the house again. If the sinuses or the rooms are clean, but your hallway wall is crooked, it is going to block your nose. Again, if your hallway wall is straight, but your sinuses are clogged, again it is going to give rise to problems. For selected patients, that's why we do both the procedures together. In that way, we are restoring the normal breathing and also restoring the normal drainage pathway of the sinuses, giving you a complete relief from your symptoms. Now let us come to the recovery process. To be very honest, first 48 hours will be little difficult for everyone because you will feel you have a very bad cold and you will feel your nose is very congested, because we put nasal sponges inside your nose, which is usually taken out at the end of second day or after 48 hours. After that, you will start nasal rinses or nasal wash with saline water and other solutions. I cannot stress this enough. This is the single most important thing you have to do post-operatively, because these rinses or the nasal wash will clean out all the dirt and mucus and clotted blood and everything which is there accumulated inside your nasal cavity and sinuses. The key for getting a quick recovery is doing the wash properly. Now, what about pain? Fortunately, pain isn't a very common complaint after this surgery. You might have little bit of nasal discomfort in the initial 2-3 days, but it goes off very quickly, and we always give some support with medication to relieve your pain. Hopefully this video has given you some idea about nasal surgeries and what to expect post-surgery. If you still have any questions, please write it down in my comment section below. I'll try to answer as many as I can. This is Dr. Debayan Tarafdar, and thank you for watching this video. If you like such contents, please subscribe and like this video. Thank you and stay healthy.